What does hope mean to you? Is it taking that extra step or just standing up? Is it running that extra mile or just walking down the stairs? Everyone defines hope differently, but at Surgenix, we want you to ask for more. We're giving hope back to patients by pioneering the next generation of medicine. Leveraging unprecedented quality, safety, and value, our products represent our vision that treatment can be different, that it can rekindle hope. Every member of our staff is dedicated to the vision that hope can be more than a dream for tomorrow, but with passion and commitment, can be something we can pioneer today. Welcome to Surgenix, where hope isn't a concept, it's a reality.
Ciao, everybody. That's Vietnamese for hello. It's 2 o'clock Sunday and time for Need to Read. I'm your host, Allon, here for this weekly hour of reading for fun, profit, and understanding, and the development of habitual critical thinking. And so with that, Sarah, and once again, I want to thank you for being my co-host and helping organize these sponsorships and the sponsorship of Surgenix Laboratories, who supplied the serum for my knee. And I want you to introduce the two doctors and let them talk about themselves.
Yeah, absolutely. Thank you so much. I appreciate it. I do want to say thank you again for having me on and being a big sponsor of your show. My medical finance company is the one that is part of contributing to the show. And then what we did is we brought our two doctors on with Dr. Green and Dr. Sabeti.
Yeah.
Sorry about that. Dr. Sabeti. And I do want to hear a little bit more about what you guys do, where you guys are located. Where do we find you? And those are the kind of little bit of things I want to kind of express to our viewers and also our listeners today.
Sure. It's good to be here.
Thank you.
My name is Sharzad Green, and I've been a pharmacist since 1990. Basically, the focus of my practice for the past 20 years has been compounding, which is the art and science of making individualized medications through the art of compounding for different needs. Our pharmacy is Community Clinical Pharmacy, which is in Mesa, Arizona. And again, the focus of my practice has been primarily natural or bioidentical hormone replacement therapy, and that includes a lot of different things, including menopause, andropause, which is male menopause, and
that really happens. Okay.
Oh yeah, absolutely, and PMS, PCOS, and sexual dysfunction. In addition to that, I also work with patients who have adrenal fatigue syndrome and thyroid imbalance, as well as pain management.
Okay. And how do you guys two work together? And as far as doing the hormone replacement, are you guys both in the same kind of industry, or a little bit about you, Dr. Sabeti?
Well, first of all, hi, and thank you for having me. I am certified in stem cell therapy, and I used to be a emergency doctor, but for the last 10 years, I focus on the treatment and cure of chronic diseases using stem cells. I use a stem cell for pain management, autoimmune diseases, hair loss, and sexual enhancement. But just for pain management, actually, I work with Dr. Green, because for pain management and using a stem cell, you need to have your hormone in balance and also your immune system to create a good environment to have those stem cells to do their job.
Okay, thank you so much. You know what? Sometimes I need a little bit of that hormone, especially me going through a pre-post menopause at a very early age at one time. So I completely understand that.
Well, I was wondering, Dr. Sabeti, like I was talking to you earlier before the show started, you say in this paper you gave me that sometimes there's maybe unscrupulous clinics or persons who are making outrageous claims about stem cells and what they can do. And then as I'm reading through that, what you use stem cells to do, I'm taken back by saying, well, they are almost miraculous. And so I'm kind of interested in some of the aspects of how it is that stem cells work to do these what seems to be miraculous healings, and what they're non-differential, or how do you say that?
Undifferentiated.
Okay.
So the thing is, stem cells are a type of cells. They have ability to repair and restore the internal system, and they have a potentiality to develop into the variety of different cells. But we have enough stem cell in our body, but sometimes due to the inflammation, we cannot get enough of those cells in the inflamed and injured area. So by doing a stem cell, we basically harvest stem cells and inject directly to the area and help your body to repair and fix the damaged tissue.
What would inhibit? What would you say? We have natural stem cells.
Yeah, basically, in fact, you use a stem cell every day, every moment to survive. Without a stem cell, you couldn't even live for an hour. So we use a stem cell every moment.
So we have now. I'm not real versed in medicine, but I notice our skin, at least the outer part of our skin is regenerative, right?
Yeah.
Yeah.
That's a very obvious example.
We get cut and scabbed over and our skin's fine, right?
Right.
But if we cut our finger off, that's not going to regenerate. But do some of our internal organs actually regenerate themselves? And
yeah, for example, our liver has the ability to repair. But talking about the limitation, stem cells, we use it. We can do a lot with stem cell, but like any other treatment, stem cell have limitations.
Okay. And Dr. Green, you're talking about the compounding of the medicines and customizing them as well.
Right, correct.
And I was kidding with you before the show about using the pedestal and the miter, and you said we actually do still use them once in a while.
We do.
But now the technology is like they took my blood when I was in the doctor's office, and they took my blood and they put it in a centrifuge. Is that
centrifuge?
Yeah, and spun it out and separated it and all that stuff, and then put the components back in. What are a couple of the machines, instruments that you use in your compounding of medicines?
Yes, of course, we still do love our mortar and pestle. That's just the gold standard. However, over years, we've been able to obtain certain machines. Certain machines have been developed, actually, that we purchased, such as an ointment mill. So basically, after we mix things by hand, we run it through the machine. And that really helps the final product to be very smooth and homogeneous.
Okay, so now we're coming up to a break, everybody, here in just a few seconds, probably a little less than a minute. And so we're going to review that these are sponsors and guests. They've helped sponsor the show. They've got my knee injection, and also Sarah is a sponsor of the show and her financing company, because nothing is cheap, even though this is a lot cheaper than what it costs to have your knee replaced or some other joint replaced. That's for sure. And there is no surgical trauma and all that. So that's really important. And Sarah's part of that financing conglomerate. And we're also sponsored by Surgenics, the laboratory that processes or keeps in proper custody, these vital stem cells. So we're going to continue on with this conversation, and we're going to talk about I guess we're going to talk about a whole bunch of other stuff when we come back from the break. So we'll see you guys in just a few minutes.
Pharmaceutical compounding is the art and science of preparing personalized medications. Compounding pharmacists are able to tailor each prescription to fit your individual needs as recommended by your physician. So when would a person get a compounded medication? Well, there are many reasons, but one could be is if a person was on a medication that was previously manufactured but is no longer available. In that case, we can order the raw active ingredient and make that medication right here in our state-of-the-art lab. Another possibility would be if a patient had an allergy or intolerance to any of the fillers and dyes within the manufactured drug. We can make that medication without those ingredients. Or perhaps a drug is particularly bitter. We have flavors and sweeteners that any child, adult, or animal will enjoy. Here at Community Clinical Pharmacy, we realize medication is not one size fits all. We offer competitive cash prices, accept most major insurances, and can deliver the medication right to your door. Our compounding pharmacists have over 100 years experience, and we have the knowledge and resources required to make clinical recommendations to you and to your physician. If you have any questions, please feel free to give us a call at 480-969-0600 or visit us at our website, communityclinicalrx.com.
Slip away on you. Welcome back to Need to Read. We're here talking with the Dr. Green and Dr. Sabeti about hormonal treatments, stem cell treatments, and I just want to remind everybody that I will have my recommended readings. I have looking right here in front of me. I was looking over some stories from all my stacks of pages. And here's a doctor-related story called The Lucid Eye in Silvertown by John Updike, if everybody's familiar with that one. And here's another one, which is real funny. Father is firm with his ailments, by Clarence Day, and he would refuse to go to the doctor. He knew what his body needed, supposedly. That's another good. I have a few more stories, and I'll be posting them up on the video on YouTube and the internet when this goes on the internet. But, and I remind you again later on in the show about recommended reading. We're going to go back to the doctors and we're going to talk about their contact information. Sarah, you have, the doctors here, their information, and just tell us yourself as well, Dr. Green and Dr. Sabeti, how to get a hold of you. And we're going to continue on with the conversation that we were having before.
So, I'm located in Tempe, Arizona. You can find more information on our website, which is integratedmedicalsolution.com. And also by calling our office to schedule the free consultation. Our phone number is 480-820-5026. And we are in Tempe, Arizona.
That's 480-820-5026?
Yes.
All right. 480-820-5026. And that's Dr. Sabeti's office in stem cells.
And Community Clinical Pharmacy is located in Mesa, Arizona. Our phone number is 480-969-0600. And our website is communityclinicalrx.com.
So that's 480-969-0600.
Correct.
And that's Dr. Green's bioidentical hormonal replacement therapy.
Right, and you're also going to find this when we post this up on the YouTube.
Absolutely.
And Facebook,
all this will be and then
you'll be able to contact them directly and then also be able to get a consultation from them as far as any other issues that you do are having. And there was a couple questions I wanted to kind of throw in there, and I was asking a little bit on our break about hormones. And I went to a partial hysterectomy about 2 years ago, and I feel like I'm in a post-menopause, but I think she kind of corrected me on that. And, I'm going through these hot sweats and, so much of a young age. And I just didn't know where do I go to get that product, or what do I need? And how would it benefit my body and affect my body long term?
Sure. I understand, a lot of times I do have patients who are much younger. So unfortunately that is the case with you, but rest assured, there's lots of help. There's plenty of help. What you want to do is you can always contact me through the phone or through email, and I'd be happy to basically give you a quick 5-10 minutes phone call, assess your situation and see where you're at, then make a recommendation for some lab work. Work with your doctor. Dr. Sabeti is excellent when it comes to working with patients as far as hormones are concerned, or your own doctor. That would be fine. And then based on that, I could tell you whether you need an appointment with me. The appointment is an hour long. It's a consultation with me. During that time, I go over your past medical history, your family history, risk factors for developing different disease, your symptoms, and your blood work. And then we come up with a plan of action. Now, these are natural and bioidentical hormones. They're not chemical hormones.
Oh, okay. I like that.
So it is part of giving you the best that is out there. And they could come in the form of a cream, a pill, sublingual drops, or troches, which are kind of like lozenges that are like gummy bears. We flavor them, and patients love them.
Oh, okay. So it's like candy, almost.
Yes,
yeah, sort of like candy.
Almost, yes.
I had to put that in there. I was like, that's a gummy bear. Okay. So, basically, you guys kind of work together on that, as well. And so how do you kind of do your consultation, Dr. Sabeti, in regards to someone that comes to you as far as hormones? Because I'm really seriously thinking about it, just for the simple fact that, I'm still kind of adjusting with my body, going through a partial hysterectomy at one time 2 years ago. Actually, I don't even know if it's 2 years. It's probably about a year and a half. Maybe it's a year and a half. And I'm still kind of adjusting, somewhat to it. It's taken me a little while.
So, here's the thing that, you need to realize that the hormone issue, like for example, you're having hot flashes and other issue is just the starting of the issue. So in long term, you might have, other issue, like, the hormones are very important to prevent the Alzheimer's disease or Parkinson's disease or anti-aging and other issues. So, what we recommend just, test and do some, like often, blood work to see your hormone levels and also do the hormone replacement basically to prevent, the further issues.
Okay. Thank you so much. I appreciate that. I definitely, will, put that on there. There's a lot of women out there, and you were saying just earlier men, that are going through the same thing, and they don't even go and get any kind of treatment or even where to go to get this kind of treatment, because to me, it's new. Maybe it's been around for a long time, but to me, it's new because maybe it's just I'm getting to that point in my time and age. So,
I wanted to, bring up the subject of my, stepfather who just passed recently, and he was 80 or almost 80, I guess. And he was getting old and he was moving around a little slow and stuff, but he seemed to be in generally good health, but his knee was in really bad shape. And of course, he couldn't, his insurance was Medicare. And so they would only pay for surgery. They would not pay for any kind of stem cell therapy or anything like that. And he was semi-associated with the medical profession. He used to be an intern or a nurse, I think. He used to shave people for surgery and other stuff. So he had confidence in the system and he knew how it worked. But, he went and got his knee surgery, and during recovery, he caught pneumonia and went back to the hospital, and he was gone in 2 weeks. It was just absolutely terrible. And if he had treated that knee with stem cells, he would be with us today. Even if it hadn't resulted in a brand new knee, it would have resulted in some kind of therapy, that regenerative therapy. And so, I really wanted to emphasize this. I think I said something about it in the early part of the show, that the cost of the stem cell treatments, it is not cheap. It's pretty expensive. And Sarah helps finance that so that people can afford it, and insurance doesn't usually pay for it. I think in your statement that I was reading that insurances will pay for stem cells when it's part of surgery.
Well, usually most of the insurance, they don't cover any type of stem cells.
Yeah.
But we through Sarah, our clinic offered the financial aid for stem cell treatment.
Yeah, and it just so happens my younger brother used to be an X-ray guy that would take pictures, and one of his duties was actually he was taking pictures during the knee operation, where the doctors would call for him to come in and take a picture, and then they would look at the picture as opposed to looking at the knee itself. I didn't quite get that myself, but there was something about the pictures that he would take that would help them understand what's going on. He was telling me, man, you don't want to go through that. He says they got the skin peeled back. They got the knee exposed. They pulled the thing off. He says, it's the grossest thing you ever saw. And I had to go in there and take pictures of it. And I thought to myself, that really is true. That is a very traumatic thing. If you have to, I suppose, if you have no choice, sure, cut me open, doc, please. I want to live. But if you don't have to, and there's other alternatives, it really is so much better because there's so many things that can happen to you, especially at his age. It was 80, and my age now is 66. I'm getting up there where I'm kind of afraid to go under, maybe, you know, so that's something I think is really important that people understand, that there are therapies to address these problems that we're getting in our age, and you can do it in the knee, you can do it in the shoulder, you can do it in all of our joints. Isn't that correctly?
Yes. Yeah.
And the medicines that you're compounding, Dr. Green, are really important to the balance of our hormones and stuff. You know, it's amazing how our hormones and our attitude contribute to our healing. Are not contribute to it, right? It's all in your mind. They used to say it's all in your mind, that you're hurt. It is kind of all in your mind, as well as there's both. You know, I know a young girl who at 12 years old still has a problem with her bladder. It could be a physical thing, something wrong, and as well as maybe an emotional thing as well.